Welcome back, guys. Today we're gonna talk about portosystemic anastomosis. But before that, we have to talk and understand the venous drainage for GIT tract. The venous drainage of GIT tract called portal venous system. The portal venous system is composed by mainly three veins: the left gastric vein, the superior mesenteric vein, and inferior mesenteric vein as well. The inferior mesenteric vein brings the venous drain from the hindgut and meet the splenic vein to drain directly to the portal vein. Also, the superior mesenteric vein brings the venous drain from the midgut and meet the splenic vein to drain into the portal vein. And the last one, the left gastric vein brings the venous drain from the stomach to drain into the portal vein. This is mainly the portovenous system. We have some abnormality when there is a blocking of the portal vein, such as in case of the liver cirrhosis or schistosoma or something blocking the venous drainage or blocking the portal vein. We have three anastomosis to decrease the blood pressure in the portal vein. We have the first one in the lower esophagus here. We call it esophageal varices here, and we have the umbilical varices here, and the last one is the rectum varices here. Okay, the first one is the lower esophagus. We call it the esophageal varices. It is connection or anastomosis between the left gastric and the esophageal vein or azygous vein, drain into azygous vein. The left gastric vein drain to the esophageal veins, which is azygous vein. The umbilicus anastomosis, we call it caput medosa. It's a bit like a dilated vein around the umbilicus. We call it para-umbilical varicose vein. It's drained between the epigastric vein and the anterior abdominal vein. Sorry. The rectum, it is anastomosis between the superior rectal and middle and inferior rectal. So what is the idea for the anastomosis? The blood pressure became high when there are blocking for the portal vein. So the blood try to find a way to go to the circulation. So these three areas make the blood go out of the portal system to the systemic circulation. Here we have a treatment for this circulation, and to decrease the blood pressure for the portal vein is the treatment. We call it TIPS, transjugular intrahepatic portosystemic shunt, which is between a portal vein and hepatic vein to relieve portal hypertension by shunting the blood to the systemic circulation, bypassing the liver. Okay, TIPS can precipitate hepatic encephalopathy due to increased clearance of ammonia from shunting. The main function of the liver here to detoxicate the toxic material like ammonia. It came from the GIT tract. The ammonia, we know the ammonia produced by the normal flora in the GIT tract, and the function of the liver to detoxicate this ammonia. When we do the bypass or do the TIPS operation here, we reduce the blood pressure, but we make this ammonia and toxin which came from the GIT tract go to the system, and the ammonia can cross the blood-brain barrier and precipitate the encephalopathy here.